My name is Ashley Estrada and today we will be learning about paranoid personality disorder. My name is Ashley Estrada and today we will be learning about paranoid personality disorder. Let's take a closer look at different personality disorders. Paranoid personality disorder is diagnosed at all ages but is more prevalent in men than women. Symptoms begin to show within the early teen and adult years. PPD also revolves around lack of trust with others, making these individuals paranoid and lonely as they do not confide in many people. There are studies that show women and lower-income individuals are diagnosed more than others. Miss Diana, I am so happy you came into the office today. I understand you have been experiencing symptoms that you believe to be a personality disorder. There are 3 clusters known as A, B, and C. These 3 clusters are home to different personality disorders. Schizoid, schizotypal, and paranoid personality disorder fall under the cluster A disorder group. Cluster A personality disorders can each be described as displaying odd behaviors and unusual thinking. These individuals may find it difficult to form relationships and often question people's motives, making trust a difficult subject for them as well. The last time we met you expressed concern for the symptoms and changes in behavior you had been experiencing the last couple of years: paranoia, low self-esteem, hostility, and an intense fear of trusting others. I am going to show you a short educational video I found on YouTube. I think this will be a helpful visual representation. After watching the video, do you feel as if you can relate to these symptoms? When Miss Diana first came to see me, she had explained she had begun to hold grudges for long periods of time, would be easily angered. She believed any comment made towards her was demeaning. This can be caused by many things such as social anxiety and life circumstances such as high levels of stress or traumas. Let's have a refresher on the video we just watched about paranoid personality symptoms. These symptoms include paranoia, lack of trust, patterns of suspicion, difficulty forming relationships, and suspicions about their partner's fidelity. Paranoid personality disorder is more than the symptoms Miss Diana has experienced. In fact, it is chronic and disruptive to one's life. Studies have shown this disorder affects 4.4% of adults in the United States. As we saw earlier, Ms. Diane came for help and was open and willing to the help of professionals, which isn't the case most of the time. Individuals with PPD are very distrusting, which includes the topic of medical advice. Individuals with PPD may also struggle with substance abuse. This is where the disorder can become dangerous to someone who needs medical attention, as they are less willing to seek assistance. Studies have shown that PPD and substance usually go hand in hand. Drugs or alcohol are used to escape the feeling of paranoia and distress, which actually makes it worse. For a short period of time, substances alleviate the symptoms and provide some relief to the individual's mental state. While substance abuse can be alleviating, it can also be dangerous. A person can begin to act out violently when feeling anxious, paranoid, or threatened. It's important to note that substance abuse does not cause PPD, rather, trauma, family history, and our childhood and upbringing are the main causes. Drug use in childhood can contribute to a disorder, but there must be other factors involved. Unfortunately, there has been very little research on the use of medication, but few studies have shown that medication use can help those who struggle with paranoid personality disorder or co-occurring disorders. There are 3 groups of medications commonly used to treat paranoid personality disorder, which are anxiety, depressant, and antipsychotic drugs. Anti-anxiety drugs. These drugs can either be stress or sedatives. A common sedative given to patients are benzodiazepines but have a high addiction risk. For many others, there are 5 SSRI medications known as Lexapro, Zoloft, Celexa, Prozac, and Paxil. These 5 medications have proven to be safer and healthier options for anxiety relief. It's important to remember that each of these medications needs to be prescribed by a certified clinician. Antidepressants and anxiety disorders have SSRI medications in common. SSRI medications are the most researched and prescribed. The purpose of selective serotonin reuptake inhibitors is to help our brains regulate serotonin levels, which allows for depression anxiety levels to decrease. It may take up to 6 weeks to see and feel results from using these medications. Common for paranoid personality disorder to be treated with antipsychotics. Most psychiatrists will prescribe other medications, although paranoid personality disorder closely resembles psychotic episodes and disorders. The exception is made if the client begins to have hallucinations or delusional thinking. There has been current research on risperidone, which is an antipsychotic that has proven to alleviate symptoms of PPD. Risperidone is also very commonly used in treating other cluster I disorders, mostly schizoid personality disorder. In the next slide I have attached a chart of drugs used in treatment for paranoid personality disorder. An important note, none of these medications can be accessed over the counter. They are all prescribed medications. Before we go, let's take a closer look at an example of denial in a client. Denial is one of the symptoms many individuals with paranoid personality disorder face. In the next clip, Dr. Phil is discussing the symptoms of PPD that he believes his guest has displayed. In the next few slides we will discuss 3 types of therapy. These 3 therapy options include cognitive behavioral therapy, group therapy, and psychodynamic therapy. Cognitive behavioral therapy. Cognitive behavioral therapy has been proven to be the most successful in a 2018 case study. CBT is focused on our thought process and the transformation of negative to positive thoughts. The goal is to grow trust for others and a positive thought process within the client. While focusing on trust, CBT also guides the client through regulating their emotions. Individuals with PPD typically feel as if others are out to get them, hold grudges, or have mistrust and are extremely misunderstood. Oftentimes, therapists will have their clients interact with other people to socialize and then analyze how they felt doing so later. This is a common exercise used in CBT therapy. Building a strong therapist and client bond with trust is very important during the process. Group therapy is another option of therapy that is just as beneficial. Group sessions give the client a more relaxed environment than a one-on-one therapy session would give. The group sessions can also give the individual more confidence to speak of their struggles, especially if other people in the group are going through the same thing. A client may also have the benefit of meeting individuals who have found a therapy and medication plan that works for them, and this can give them hope towards finally understanding and managing their disorder. Psychodynamic therapy. Psychodynamic therapy is based on the work of Sigmund Freud. This version of therapy is also not as focused on the client and therapist relationship. Rather, the focus is on the client and their relationship with the outside world. Psychodynamic therapy is typically used to treat depression and psychological disorders such as paranoid personality disorder. Within psychodynamic therapy there is something called dream analysis. This technique is used in psychodynamic and psychoanalytic therapies. Dream analysis occurs with the encouragement from the therapist to the client. The client is encouraged to speak openly about their fears, fantasies, and dreams while also processing the emotions that may arise from their fears or fantasies. The purpose of this is to allow the client a judgment-free space just as our dreams carry no judgment. Well, this brings us to the end of a paranoid personality disorder treatment plan. Symptoms. As her can find some comfort in noswing, there are a few different options for treatment from medication to psychodynamic therapy. There are plenty of options and resources to gain control of this personality disorder.